Welcome back to 3 Talk. After seeing Dr. Noleen Cahi on 3 Talk, Thulani Masango's sister wrote the doctor a letter asking him to please help her brother. After struggling with the appearance of his teeth for many years, Thulani got the smile of his dreams, and he's here to tell us how his new teeth have changed his life. Please welcome Thulani Masango. Thanks so much, Thulani, for joining us. When did you first realize that your teeth were problematic?
Actually, at an early age, that's when I realized.
Did you go to a dentist?
I went to several dentists before I came to Dr. Noleen.
Yeah.
I think around about Eastern and about Mpumalanga.
Yeah. And what were they saying to you?
No, man, they failed me a lot. They failed me.
Yeah.
I thought nobody will help me.
Okay, so there you come in, Dr. Cahi, because his sister wrote to you and said, my brother has a problem, has been to many dentists, was not being helped. Did you also have that fear that you may not be able to help him?
No, not at all. I told her to get him to make an appointment. He came and saw me. He was, again, stressed, upset, and he had a very, very unfortunate smile. I'm not sure if you have the photo of the before photo, but Thulani had a condition which I still have not confirmed, but which I thought was something called amelogenesis imperfecta, which is a word meaning that the enamel is poorly developed.
Yeah.
And the enamel...
That's you, Thulani, when you just got to Dr. Noleen Cahi.
And there was a combination of what we call fluorosis, which is excessive...
Look at that.
Yeah, excessive fluoride in the water of where he grew up.
Yeah.
And this enamel that looks poor. It looks poor in quality and quantity. And I recognized that he was a young, good-looking guy, and he needed to improve his smile to get ahead personally, professionally, in his business.
Yeah.
And so we had a long chat, and we discussed the pros and cons of what we could do for him. Obviously, finance was a problem, but he has been the most amazing patient. He's still paying the treatment off, which we started 4 or 5 years ago. He pays a little bit every month, and it's just the most wonderful honor to be able to help him. And he keeps telling me how fantastic he feels and looks, and it's still not finished. But I mean, look at his smile. It's just so he's confident. And
I can imagine, Thulani, that when your teeth looked like that, your confidence levels were also quite down.
Actually, I was very, very down.
Yeah, because you didn't want to smile, you didn't want to, Tell me about those days.
Even though I was still young, but, my confidence was very, very low. I couldn't smile. I couldn't, feel that comfort, you see. So I was always swearing, until I met Dr. Noleen Cahi.
Yeah. So what kind of procedures did you do? Because, I'm imagining that, some of you are sitting at home now and saying, my goodness, my teeth look like that. Maybe Norman would be able to help me. So what procedures and how long has it taken?
Well, Thulani underwent a series of cleanings, dietary advice changes, lifestyle changes to eliminate all possible problems.
Yeah.
Then he underwent fillings that needed doing.
Yeah.
He then underwent a bright smile treatment, which is the teeth whitening.
Wow, look at that. Sorry to interrupt you.
Exactly.
I'm just looking at those teeth.
Amazing. It's absolute. He's now with upper temporaries. The upper teeth are all made out of acrylic by my technician.
Yeah.
I've got a wonderful technician, Remo, of Schunitz Laboratory, and he did the temporaries. The lower teeth have not been completed, as you can see.
Yeah.
But only his top teeth really show, so he's happy to carry on his life as long as his gums are healthy.
Yeah.
And we'll get to it. We'll eventually give him the Hollywood smile that he should have and that he deserves.
I think that's a Hollywood smile right there. Thulani, thank you so much for joining us. After
Thanks,
the
Noleen.
break, we'll have all the information you need to keep your teeth in optimum condition. But before we go, one of the most effective ways to care for your teeth is to go for regular cleanings, as this gives the dentist an opportunity to catch any potential problems in their earliest stage rather than waiting till serious intervention is required. I popped into Dr. Cahi's rooms for a cleaning. Take a look at this very simple procedure that will keep your teeth both clean and healthy.
Morning, Noleen. It's lovely to have you back in the practice. It's been a long time.
Really? It's not so lovely for me. I really get very anxious. I know that I'm just going to do a checkup and a clean, but it's always kind of, anxious moments for me.
Stressful.
It's stressful. It really is.
But I won't take that personally.
No, don't. No, I love you. I just don't like this chair.
Okay. All right. So today, let's start off with a checkup, Noleen. It's been a long time since I last saw you.
It's been 6 months. You said I must come back every 6 months.
Okay.
Yes.
All right. Let's leave it that it's been 6 months.
Mimi, it has been 6 months.
Mimi, check on the card. Is it 6 months or is
It is 6 months.
18 months?
No, it is 6 months.
Okay.
I was last year in November.
All right, darling. Now let's have a look. Let's have a look. How many months?
6 months.
6 months, all right. Okay, so today we are going to do a cleaning to get rid of all the plaque and to get rid of some of the staining that's on your teeth.
Okay.
That is the cornerstone of all dental care, is oral hygiene.
Yeah.
So if we keep the plaque at bay, plaque is the matter that forms on all our teeth.
Okay.
If we keep that away, then we keep most dental problems away.
Okay.
So let's start with the cleaning.
So my teeth are fine.
Yes, absolutely, your teeth are fine. All right. This is a scaler that I'm going to use. It's called a scaling. It's an ultrasonic machine, and it literally vibrates the tartar away from your teeth. And then we're going to floss your teeth, and then we're going to polish your teeth, and we'll end up with a fluoride treatment. Fluoride is an excellent protective mineral for your teeth. Okay. We're going to do a fluoride treatment. As I said, fluoride's very, very therapeutic for the enamel of the teeth. It will help desensitize your teeth, especially after that heavy scraping I gave you. All right, open wide. Bite together, suction, paper towel. Open wide, open. Thank you. Relax your face, just relax your face. There we are. Open wide again, wide open. Open your mouth, good girl. Bite together, thank you. I'm sorry, I know it's very gooey. And then after this, I don't want you to eat or drink for half an hour.
Okay, so Norman, my teeth are all clean now.
Absolutely. And that's how we want to keep them. Nice, fresh, clean, plaque-free and stain-free.
Okay. You're back with 3 Talk. 40% of adults worldwide suffer from some level of gum disease. Besides the effect this has on your teeth, the health risks associated with poor oral health are dire. Even with regular dental checkups, how you care for your teeth at home is critical. This afternoon, we're finding out everything we need to know about looking after our teeth. We assume we're doing the right thing at home, but we are probably not. What is the best way of taking care of our teeth? Brushing regularly, but how we brush.
Correct. Brushing is the cornerstone of oral care. So it's very important that the patient is shown how to brush and that it's reinforced every time you see the patient. So brushing, flossing, using a mouthwash with fluoride, watching what you eat, not too much carbohydrates, not too much sugar, not too much starch, because it's the combination of starch and sugar that produces the acid that eats away our teeth. So that's important.
Okay.
It's acid. Acid is the thing that damages our enamel.
And beetroot, red wine,
no,
red
that
juices.
doesn't damage your teeth,
Nothing.
but it discolors your teeth.
Well, that's part of damaging your teeth, isn't it?
Well, you can discolor your teeth and we can reverse it.
Okay.
But I mean, damage, we're talking about dental disease, dental decay,
All right.
where the teeth needs to be drilled and compromised.
Yeah.
But
And I've seen many people opening bottles with their teeth.
that's a no-no.
Opening bottles with
Absolutely.
their teeth. I've
Yeah,
seen a woman do this.
Absolutely.
Opening a bottle with her
Yeah.
tooth.
Or hair clips, putting a hair clip, chewing a pencil. These are all absolute no-nos for dental health.
Okay, so how do we brush our teeth?
Okay, the way we've been taught and the way we like to train our patients is what we call a modified Bass technique. Basically, it means that you hold the brush with your thumb quite close to the head of the brush. We use a very good quality brush with rounded bristles.
Obviously, you're not going to use this size brush. That won't work for you.
So, good dexterity. This is a manual brush. As you know, we've got ultrasonic brushes, electronic brushes, battery-operated brushes. But for the general public, manual brushes are good as long as you know how to brush.
Okay.
The secret is to place the brush not flat on your upper teeth, but slightly angled up so that the bristles actually gets into the gum margin.
Okay.
This is called the gum margin, the scalloped area of the gum over the tooth.
Right.
That's the neck of the tooth. It's that area, the neck of the tooth, that the plaque accumulates, that the germs invade the body, that causes gum disease.
Okay.
So if you place the brush at an angle, you can quite clearly see the bristles get into the gum margin, and then it must be rotated. It's not good to scrub your teeth, and it's not good to up and down, because all this does is it rips away the gum.
Okay,
And it creates
so
a lot of...
there and then kind
It
of...
has to be a circular fashion, and the secret is to clean every surface of every tooth. So it's no good only cleaning the outside. We then have to open our mouths, place the brush on the inside, and give it a good scrub. So turn your hand so that your thumb is at the back of the brush, invert it so that your thumb's almost rubbing your nose, and scrub the back of the lower teeth.
Okay.
That is where your tongue is. That's the most critical area where stains, smoking, and all the damage is.
Okay.
All right. And if that plaque is not brushed away,
It's
going
to build up,
It builds
obviously.
up, it calcifies, it becomes hardened, called tartar, and then a brush won't remove it. And that's when you have to have a professional dental cleaning, where it has to be scraped and professionally cleaned.
You know, and we do this every day. We brush our teeth, but we're doing it wrong. Everyone wants sparkly, pearly whites, and now you don't have to be a Hollywood star to have them. We'll be chatting about tooth whitening when we return. Are we going to an insert now and then talk and then go to another insert? Okay. We've got little talk time. But those inserts were good, I think. Yes? Well, no, we're not on air. You will be on camera because there are cameras and they've got to be on us. You can take the floss away.
Oh, yeah, I didn't floss. Where is
Can I floss now?
Yes, this is your floss, so keep it.
No, it's Joanne's floss.
So is this the last section?
Last section.
And it's on teeth whitening. Can I leave this here?
Take the floss, my papa.
Yeah.
Welcome back to 3 Talk. One of the simplest ways to instantly make over your smile and look like a Hollywood star is tooth whitening. With modern bleaching technology, you can see dramatic results in just 90 minutes. As part of her smile makeover, 3 Talk producer Joanne Lurie did the Bright Smile treatment.
Morning, Joanne. How are you feeling? It's nice to have you back.
It's nice to be back.
How are you feeling?
Very relaxed.
That's good to hear. That's great. We did your extraction a couple of weeks ago. We took out that tooth that was very badly damaged. You're wearing your partial plate. How have you managed with that?
Absolutely perfect. I barely know that it's there.
Okay, great. All right, please remove it.
Okay.
Have a rinse. The reason why we are whitening your teeth now is because when I get to the stage where we're going to do the bridge for you and the crowns, we want the color of the porcelain to match the new color of your teeth. That's why we're doing the main Bright Smile whitening today.
Okay.
This is a tooth whitening process. You'll be here for 2 hours, although you'll be under the light for an hour and a half.
Okay.
It may be a sensitive appointment for you, but nothing that you won't manage.
Okay.
All right, and if you are that sensitive, we'll give you 2 mild analgesics afterwards. Okay.
What am I going to do for 2 hours?
You're going to watch television.
Okay.
You can play on your phone, but you can't talk.
Okay.
All right. If you need to communicate with us, just put it on your phone or indicate that you need a paper and pen, and we'll give it to you.
Can I just ask you?
Yes, of course.
After we finished,
Yes.
what are the things that I need to be careful about?
Okay. The critical thing to remember is no smoking.
Why did I ask?
You asked and I'm telling you. No smoking. Nothing that will stain a white shirt. So no red wine, no green tea, no black coffee, no smoking, no curry, no soy sauce with sushi.
Okay.
What else, Mimi? No colas.
Smoking. Okay. For how long?
For at least 48 hours after today. We're going to show you in a minute, but I'd like the camera just to get your result. It's absolutely wow.
I'm dying to see.
It's fantastic. Okay.
Oh my word. Oh, they're so white.
And enjoy your beautiful new bright smile.
I cannot believe it. Look at that.
I'm thrilled. Well done, Joanne. We're
Thank
proud of you.
Well, that was one happy customer. Is a whitening, can it be dangerous at any point?
Oh, absolutely not, unless it's not done by a dental professional.
Yeah.
You know, it must be supervised by a dentist or a dental hygienist, dental therapist. then it's not dangerous in any way.
So explain the procedure for me, because there were a lot of things that you were
Well,
putting
that
on.
specific procedure is called Bright Smile, which is very widely known. It is a system where we use an LED light, which
Okay.
looks like a blue light, to activate the bleach. The active ingredient is hydrogen peroxide. And the gel is placed on the teeth. This light is used to activate the gel, the bleach.
Okay.
It gets absorbed into the enamel. There's absolutely no damage to the teeth whatsoever. It breaks up the stain molecule.
Yeah.
There's no stripping of the enamel in any way. These are some before and afters of patients that have had whitening.
Okay.
And then they've obviously had further cosmetic work,
Okay.
not only whitening.
All right.
But I mean, your smile tells the world who you are. I mean, it's so important to have this wonderful, bright, healthy smile. And it opens doors for you. I mean, you feel confident.
Your confidence.
Yes, you're
it
confident.
certainly
It boosts you.
Yeah.
And you're friendly, and it builds credibility if you're smiling at people. You know, Mother Teresa even said it costs you nothing to smile. It's just such a beautiful gift. It's an act of love.
Yeah.
And that is what a smile is. So it's wonderful to be able to give people that beautiful, white, healthy smile. And for a lot of people, they equate whiter teeth with vitality, with health, with youthfulness, with beauty. And let's face it, who doesn't want whiter teeth?
Absolutely. Everybody wants whiter teeth. Now, one of the easiest ways to maintain your bright white smile is with a 30-minute top-up treatment every few months. We took our cameras to film Dr. Cahi's patient, Russell Krawitz, getting his top-up.
Russell, it's nice to see you again. I'm going to just show you the color of your teeth that they were before we did your whitening. Just have a look in the mirror quickly. This is the color that your teeth were before we did your whitening. It was a B3. The color of your teeth now are about, I'd say, an A1, similar, or an A2. But we'd like to get your teeth back to what they were after we did the initial whitening, which was a B1, which is much brighter than you are now. Today we are going to do a top-up using a product called Opalescence. It's a 45% solution of peroxide. We've made for him models, and I've made specific bleaching trays which have been designed specifically by my technician to accommodate the bleaching gel, which then gets placed into this bleaching tray and then placed on his teeth. Russell will sit here for a half an hour while this bleaching gets absorbed into the enamel of his tooth. People that have whitened their teeth should do this maintenance every 6 months at least. It's only 350 Rand, so it's not an expensive maintenance. And it's definitely worth it if you want to maintain the whiteness, or should I say the optimum whiteness. The trays are placed onto the teeth very gently, and the patient is told to relax, and you're going to sit like that for a half an hour. Okay, Russell, the time is up. You've been here for a half an hour with the bleaching tray on. I'm just going to remove it now, and then please have a rinse on the left. I think you've had a pleasant result. I mean, it's not a startling improvement, but you need more than one top-up to go back to what you were. And I'll see you in 3 months.
I just love the magic of TV. After 1 second, 30 minutes is up. But we kind of understood what you were doing on Russell. But if it's every 3 months for a top-up, what if someone smokes, drinks red wine, eats, all the things that are bad for your teeth, that would discolor your teeth? Should you go more often?
You can. You can take your trays home. You can buy the gels from dentists. And once you've been shown how to use it and shown what to do, as long as it's supervised by the dentist, supervision means you're in telephonic contact.
Yeah.
You do it at home, in the privacy of your home, in the privacy of your office, on an aeroplane, on holiday.
Yeah.
It's a very simple procedure to do, to keep the whiteness.
20 seconds, who is a good candidate for a whitening?
Anybody whose teeth aren't predisposed to extreme sensitivity is a
Okay.
good candidate. Anybody that doesn't have severe gum disease is a
Okay.
good candidate. Anyone who's pregnant
Thank you
is
so
not a
much,
good
Norman,
candidate.
for joining us. Now, obsessive compulsive disorder is an anxiety disorder in which people have unwanted and repeated thoughts, feelings, ideas, and sensations. With treatment, OCD patients can learn to live with the disorder. Tomorrow on 3 Talk at 4:35 p.m., we'll be speaking to people living with OCD and we find out how it's treated. Until then, from all of us, have a great evening.